Hi, it's Kristan with Women's Care Center. The moment that you find out you're pregnant, there's usually a rush of emotions. Maybe you remember feeling happy, anxious, nervous, excited, scared, worried. Maybe you felt all of those things and a few more. Sometimes understanding what's going on inside of our bodies during those 9 months can help ease the intensity of some of these feelings. Also, understanding baby's development can help us and our partner bond with baby before the big day. Today, let's take a look at the 3 trimesters and what's really going on inside our bodies. But before we do that, let's do our breathing exercise. With your eyes closed, take a deep breath. As you exhale, imagine any feelings of being overwhelmed begin to leave your mind. Take a few more deep breaths and focus each time on the deep breath in and the slow breath out. Pregnancy should be an enjoyable experience, but sometimes the unknowns can make it extremely difficult. Take a few moments each day if you find yourself feeling overwhelmed and practice your breathing. Just pausing for that short time can help us relax and find our peace once again. With each trimester, you'll begin to notice a change in your body and your emotions. Growing a baby inside is hard work. During your first few weeks of pregnancy, you'll likely feel more tired than usual. Your breasts may also feel more tender. Many women experience morning sickness, although not just in the mornings. You and your partner may also notice a change in your emotions. Hormone levels are changing drastically during those first few weeks of pregnancy, and it can cause a lot of feelings. Your baby is also going through a lot of changes. The first trimester includes the first 13 weeks of your pregnancy. During these weeks, the placenta and the umbilical cord form. Your baby's heart begins to beat, and arms, legs, toes, nose, fingers, ears, mouth, and even teeth buds are all forming. In fact, by the end of this trimester, all of baby's organs are formed, although they're not ready to work on their own yet. By the end of the 13 weeks, your baby is roughly the size of a peach. During your first trimester, you should recognize any harmful habits that can affect you and baby's health, such as smoking and alcohol. It's also time to find a healthcare provider and schedule your first appointment. By the time your second trimester hits, many women begin to feel less nausea. You may notice an increase in your appetite, and you'll probably have to start shopping for those maternity clothes to accommodate baby's growth. During the next few weeks, you may begin to feel baby move. Some women describe it as a feeling of butterflies or gas bubbles. Between the weeks of 14 and 27, baby still has a lot going on. She begins to put on some weight, and usually during this time, you can find out her gender through an ultrasound. Her senses begin to develop, and on an ultrasound, you may even see her sucking her little thumb. Those butterfly movements also become some strong kicks as the week progresses. By the end of the second trimester, baby is roughly the size of a cantaloupe, and we just keep moving through the produce section. During your second trimester, you can sign up for childbirth classes and schedule a tour of the hospital or birthing center where you'll be delivering. If you'll be returning to work, now is a good time to get recommendations for daycare providers. And if you know baby's gender, start working on that name list. Your third trimester is from week 28 to week 40. You may feel a shortness of breath as baby begins to take up more room. Your body begins to prepare for birth with practice contractions, also called Braxton Hicks. It's also normal to leak your first form of milk, which is also called colostrum. During the last trimester, your baby is finishing up her development to get ready to meet the world. Her brain begins to rapidly develop, and the hair on top of her head begins to grow. Her lungs are getting stronger, ready for that first real breath. And in the later weeks of your pregnancy, she'll begin to move lower into your belly and assume the head first position. By that 39th week, your baby is the size of a watermelon. During the last few weeks of your pregnancy, you can begin to gather the necessary supplies and make sure that baby has a safe place to sleep when you get home. Install your car seat and be sure that a certified technician can check to be sure it's installed properly. You also may want to begin selecting a pediatrician and make sure you get that hospital bag packed. Sometimes in the middle of pregnancy, these 9 months can take forever. But there's a lot going on inside of you to get this little one ready. Do your breathing exercises and remember to try to focus on the beautiful parts of this experience. Soon she'll be here and pregnancy will only become a memory. I hope this video and the next few ones in this series can help make this positive experience even more beautiful. Thanks for joining me. I'll see you next time. Bye-bye.